Alright, so now we're going to do palpations on the anterior side of the hip. First we have the iliac crest up here. Following it in, we have the ASIS. Following that down, we find ourselves onto the AIIS. And in order to find the pubic tuberosity, we ask them to put their hands together on their belly button and walk it down until they find bone. And we palpate over top and ask if they have any pain. Any pain?
Nope.
Right. And that's it for the anterior side. All right, now we're doing the posterior side of the hip, and again we come and find ourselves at the iliac crest, working our way back to the PIIS or PSIS, and work our way down to the PIIS. On the side, we can poke your hip out that way. We have the greater trochanter of the femur. When you go under and you push up on the butt, you have the ischial tuberosity. Now we're going to do the posterior muscles on the hip. First we have the gluteus maximus, which is here, and it attaches as origin of the posterior sacrum, the ilium, and the superior gluteal line. And its insertion point is the gluteal tuberosity and the IT band. The actions of the gluteus maximus are hip extension and external rotation. Now we have the glute medius, which has an origin at the iliac crest and the anterior gluteal line, and its insertion point is the lateral greater trochanter of the femur. Its action is hip adduction and internal rotation of the hip. Now we're going to do the glute minimus, which is a deep muscle, so I can't really palpate it, but has an origin of the posterior ilium, and it has an insertion point of the greater trochanter of the femur, and its action is abduction and internal rotation of the hip. Now we have the piriformis. It acts as an external rotator of the hip. In order to feel or palpate the muscle, we do knee flexion. We place an elbow right in the center of the buttocks, and we rotate externally and internally at the knee, feeling the muscle rotate underneath our elbow. Now we have on the anterior side of the hip the pectineus, which has an origin at the anterior pubis and an insertion at the pectineal line of the femur. I'm not going to palpate it because it's too close to the crotch area, but what it does is hip adduction. So now we're going to do the adductor longus and the adductor brevis. The adductor longus has an origin at the pubic symphysis, and the adductor brevis has an origin at the pubic ramus. They both run down the side, inside of the thigh and insert at the linea aspera, and their actions are both hip adduction and internal rotation. Now we have the adductor magnus, which has an origin at the pubic ramus and the ischial tuberosity, and it has an insertion point at the adductor tubercle. Its action is hip adduction and internal rotation. Now we have the gracilis, which has an origin at the pubic symphysis and the inferior pubic ramus. It runs down the medial side of the thigh all the way down to the pes anserine, and its action is hip adduction, knee flexion, and internal tibial rotation. Now we have the tensor fasciae latae, which has an origin at the iliac crest and the ASIS, and it runs down into the IT band all the way down to the Gerdy's tubercle. Its action is hip abduction, flexion, and internal rotation. So now we have the sartorius muscle, which goes from the ASIS down across the thigh to the pes anserine, and it does knee and hip flexion and external rotation at both the knee and the hip.
So first we're going to be testing the hip flexor group, which is rectus femoris and iliopsoas. And in order to do this, you're going to ask your patient to lift or to flex their hip, and they're short sitting here. And you brace their back and press down for 5 seconds. Ready? 1, 2, 3, 4, 5, relax. Okay, next we're going to be testing hip flexion, specifically iliopsoas. So you're going to ask your patient to lie supine, put them into hip flexion and slight abduction, and externally rotate the thigh and toe. And stay here for me. You're going to stabilize the opposite ASIS and push them opposite of what they're in. Ready? 1, 2, 3, 4, 5, relax. Our next manual muscle test is the tensor fasciae latae. So your patient is still supine, still hip flexion and slight abduction. And then you're going to internally rotate with the toe in and the thigh in. And so you're still going to stabilize the ASIS and push inward. Ready? 1, 2, 3, 4, 5. Next, we're going to be testing the hip adductors. So you're going to cross the top leg over, like so. Make sure the patient is in a straight line. Then you're going to lift the lower leg. This is the leg you're going to be testing, and stabilize the hip and apply pressure to the medial knee or aspect of the knee. Ready? 1, 2, 3, 4, 5. Relax. Next, we're going to be testing the medial rotators. So your patient's going to be sitting or short sitting, and what you're going to do is ask them to medially rotate their femur this way, and you're going to stabilize the medial aspect of the knee and push their femur into lateral rotation. Ready? 1, 2, 3, 4, 5. Relax. Next, we're going to be testing the lateral rotators, which is very similar to the last test we did, except the opposite. So they're going to be laterally rotating their femur, still short sitting, and then I'm going to be stabilizing the lateral aspect of the knee and pressing laterally on the lower leg. Ready? 1, 2, 3, 4, 5. Relax.
Okay, now we're going to do the manual muscle test for the gluteus minimus. You're going to have your patient side lying, and you're going to put them into slight abduction. You're going to stabilize at the iliac crest, and your directional force is going to push them into adduction. Ready? 1, 2, 3, 4, 5. Relax. Okay, now we're going to be doing gluteus medius. Your patient's still going to be side lying, and you're going to put them into abduction, slight extension, and external rotation. You're going to stabilize at the iliac crest, and your direction of force is going to be adduction and flexion. Ready? 1, 2, 3, 4, 5. Relax. Okay, now we're going to do the manual muscle test for gluteus maximus. So your patient's going to be lying prone. You're going to put them into knee flexion and hip extension, stabilize the lower back, and apply pressure towards hip flexion at the distal hamstring attachment. Ready? 1, 2, 3, 4, 5. Relax.
All right, now we're going to do the special test called the Faber test, and we bring the patient up into a figure 4 position, and we brace at the ASIS and at the medial portion of the knee, and we push apart from each other. And this tests for SI joint dysfunction or tightness in the groin. Now we're going to test the SI compression and SI distraction, and this tests to see if there's any joint pain of the SI joint. So SI compression is pushing on the ASIS on both sides away. This compresses the SI joint. If this causes pain, then there's something wrong with the SI joint. And distraction is pushing the ASIS on both sides in towards each other, and this causes a distraction of the SI joint, and if it relieves pain, then there's something wrong with the SI joint. So now we're going to do the Thomas test, and in order to do this, the practicer places their hand underneath the lower back, and they raise the knee up to the patient's chest, and you're looking for a raise in the thigh like a jump, and that means that there is tightness in the thigh. All right, now we're going to do the Kindle test, which is very similar to the Thomas test, except for now they are lying with their legs hanging off the table. So again, you place your hand in the lower back, and you raise their knee up to their chest, and this tests for tightness in the rectus femoris. The ischial tuberosity, and I blanked. Ischial tuberosity. Okay, now we have
No?
of the femur. I'm not going to palpate it because it's too close to the crotch area.
Going to Move your elbow. Next, we are going to be medial. Hello.
Now we're doing SI joint compression and decompression in this test for.
Okay, next we're going to be testing the lateral rotators, and this is very similar to the last test that we did, but except they're going to be rotating medially. Abduction, and then externally rotate the femur and aspect. Needed a lap. All right.